We have the health benefit exchange bill that is being heard in the General Assembly.
My name is Tish Galu and I live in Orange County. My family is quite typical for small business owners and employees all across North Carolina and across the nation. This is our story. Small business owners want to provide health insurance for their employees and themselves, but they can't. I've owned a small business, I've worked for a small business, my daughter owns a small business. As the cost of health insurance has escalated over the past 20 years, fewer and fewer small businesses offer health insurance. It's just too expensive. If the health benefit exchange is set up right and has real competition, an easy, reliable way to compare plans and enough resources to keep the premiums affordable, with a special emphasis on wellness, thousands of small business owners and employees like my daughter would have affordable health care, better health, and a better business. The health benefit exchange has to be friendly for small businesses. If it isn't small business friendly, if it is set up to benefit insurance companies and brokers or a provider group, it will be a real tragedy. We will have missed a real opportunity to keep the small businesses that create most of the jobs in North Carolina. Instead, it will be a risk, they will be at risk of failure. They won't be able to compete with the large chains and the large companies. I don't think that they should be at all. And I have worked for a pharmaceutical company many years ago. It just would not be beneficial. The largest insurer is Blue Cross Blue Shield. My understanding is that they cover over 90% of the people in North Carolina. That's not a lot of competition for other companies. You have to have a clear understanding of what needs to be within this exchange to help small businesses, to help people run their companies. They need to be able to know that it isn't being manipulated by insurance companies. Find small businesses that have health insurance programs to see how they have done it, to see what they've run into that have been problems, to see where they can help organize a program like this. And you've got to go out there and talk to small businesses across the state to figure out the best way to do this. They have to be involved in it.